Hi, I'm Morse, the founder of Core Elements Training. In this video, we're going to demonstrate the use of electro-dry needling or electro-needling. We're going to focus the needles into the rectus femoris, and the electro-needling will be really useful for clients that might have a lot of hypertonicity or a lot of muscle tension or muscle spasm in the area. If the muscle such as the rectus femoris is really tight and it's in a shortened position, it could be leading to generalized knee pain or other conditions such as patellar tendonitis or patellar tendinosis. Absolutely, in the cases of patellar conditions or the tendon conditions down here, we could needle directly into the patellar tendon. But we would also want to accompany that with wider needling to the quadriceps muscle group, or more specifically to the rectus femoris. Where we've got lots of tension in the muscle tissue, then the electro-needling can be really useful because it helps to create that muscle contraction or that strong twitch response, which then leads to further relaxation within the tissue itself. For the purposes of today, we are going to use the Pointer XL2, and this is going to create that electrical stimulation to the needle. So first of all, we need to prepare the tissue. So we have wiped the area, so we've sterilized the tissue itself and also the hands of the therapist. Then we are going to apply the needles. Okay, so again, as with all dry needling, what we might do is palpate for areas of maximal tenderness. Okay, now I can feel with Katie, the client today, she's got some tension here. She's got a common trigger point here, and she's also got some tension here. So I'm going to place 2 needles into those 2 spots. I'm using these single-use sterile needles, and I'm going to use the perpendicular direction of needling, which is where we needle straight down into the muscle tissue. I've tapped the needle into the area, and then we're pressing down roughly about halfway. Okay, and then the second needle. So again, on palpation, we identified that the tension was about here. And again, I'm going to tap in and press down roughly about halfway. Now with our straight needling, we could leave these to activate the tissue for a little while. We could then do our common activation methods, such as our flicking, such as our turning, and also with our peppering. But what we might find with some clients where the tissue is really tight or in that hypertonic state, when we pepper, we might get multiple twitches. And through stimulation of the needle, we might find that the tissue just keeps twitching and twitching and twitching. So in those instances, to speed up that relaxation response, what we can do is use the pen. So in this instance, we're going to use the dials here and set the amount of frequency that we want to come through. So we have got our intensity, our sensitivity, and we have got the Hertz dial here. So we need to set that accordingly. Okay, and first of all, we want the dial here to touch the client's skin. And then I'm going to press the pen onto the needle here and press down. So the client is then feeling some activation. What we can also do is we can stimulate between both of these needles here. So we're just going to put a little bit more stimulation into the pen. And now here, the grounding plate is going to touch one needle. I'm touching the cord, so I'm not touching the actual needle itself. And the other one here is going to touch the other needle, and you might be able to see carefully on the camera that the tissue itself is contracting. So if we look at the tissue just about here, you'll see that that is contracting, and that's creating that sensation in the muscle fibers. And after the tissue has contracted or been stimulated and twitched, then those muscle fibers will relax to a greater extent. Okay, so 2 different activation methods there. We can have the grounding plate touching the client's skin, and we will stimulate one needle. We're not seeing any deep twitching there. Okay, or another method where we're sending the current between these two needles here. Okay, the grounding plate is touching one needle, and just so that I've got my hand out of the way of the camera, then the other needle is stimulating the tissue there. And in this instance, we're sending that current between the two needles. We can see just around this needle here that we've got some nice reddening to the area as well, which shows that we've got that increase in localized blood flow. Okay, so that was our demonstration of our electro-dry needling or electro-needling using the Pointer XL2 pen, okay, on the rectus femoris, which is great for helping to reduce hypertonicity within the muscle tissue, helps to increase localized blood flow as well, and helps to re-stimulate that healing process, triggers a relaxation response in the tissue, but also useful for when the client is experiencing generalized knee pain, or we might have tension within the tendon as well, which in this instance is the patellar tendon.